Orthopedic surgeons at Livingstone Hospital cannot operate on patients with broken bones because they do not have implants. Dear patient, you have been admitted to Livingstone Hospital because you need urgent emergency treatment for an orthopedic condition. Unfortunately, the implants needed to best treat you are not currently available at the hospital. Depending on your injury and delay caused by the inability to use implant, you may not be able to be treated surgically and have poor results. Your doctors were not informed when the implants would be reusable, and no alternative hospital was given to transfer you. This is text a letter to orthopedic patients who cannot be helped at Livingstone Hospital, one of 3 tertiary care hospitals in Eastern Cape and one largest and busiest casualty units in state. The hospital is estimated to serve approximately 2.5 million people, most of whom live in the surrounding rural areas. The letter lists 3 phone numbers: one hospital complaint service, another for the Eastern Cape Health Department complaint line, and a 3rd presidential helpline. Desperate patients with broken arms and legs beg for help, but doctors say there's nothing they can do. The sad truth is that most of our patients think the wait is acceptable for them, a hospital source said. Patients also worry that complaining will jeopardize their chances of having surgery. There are no resources to treat trauma emergencies to a medical legal standard, clinicians warned in a letter to department managers in 2021. Yet the crisis continues. Department actions. In a written response to Eastern Cape Legislature a month ago, Head of Eastern Cape Health Department, Dr. Rolene Wagner, said department provides illness notes and additional medical reports to patients whose jobs depend on successful surgeries. Additional support is provided by referral to the social worker and, where appropriate, a referral for temporary benefits is also facilitated. Sourcing of implants, medical and surgical supplies continues, supported by the approval of relevant tenders, modified supply chain management regulations, she said. The hospital also said it is working with regional hospitals to see what surgeries can be done here. However, the department was unable to provide a time frame for when the backlog of surgery would be addressed. It said it will do their best to do so in the 2023-2024 fiscal year. Patients are not referred to other facilities in or outside the province, especially for backlogs from Livingstone. Referrals are generally made for specialist care in central hospitals or specialist interventions that are not performed on site. Failure of governance and oversight. The last time a permanent CEO of Livingstone Hospital was in 2018, when he forced CEO Thulane Madonsela and her management team out of the hospital after violent protests from 4 unions organized by Nehawu. Madonsela eventually resigned after being suspended by the department's former head, Dr. Tobile Mbengashe. Madonsela and her management team were recently paid millions after the Labour Court ordered each of them to be reimbursed with 6 months' salaries and legal costs. The court upheld an arbitral award that their suspension was wrong. In December 2022, Dr. Mtandeki Xamlashe, then acting CEO of hospital, admitted to the Overseeing Health Portfolio Committee at Livingstone Hospital that there was a shortage of orthopedic implants and that more than 100 trauma patients were on waiting list. Xamlashe has since been promoted to senior management in the provincial department. In a report adopted by the Health Portfolio Committee in February, lawmakers wrote it. The acting CEO presented to the committee and emphasized that the facility has been impacted by COVID-19 and that there is a governance breakdown. He also stated that the morale of the staff has been adversely affected by COVID-19. Acting CEO noted that they did not receive any support after COVID-19. He stated that there is a serious staff shortage in the hospital and the care is very poor. The hospital currently has 400 unpaid beds. Failed legislative intervention. In June last year, the Eastern Cape Legislature passed a resolution unanimously made by Jane Cowley of the Democratic Alliance that state hospitals should pay orthopedic implant suppliers to public hospitals. However, the payment did not take place. On the Daily Maverick EC legislature orders State Health Department to pay for orthopedic implants to avert humanitarian crisis. The shortage of orthopedic implants was brought up again in a letter a number of senior doctors on the subway. Health MEC Nomakhosazana Meth blamed COVID-19 and possible duplication of bills. In August 2022, the department acknowledged that it owed $52 million to orthopedic implant suppliers. In his response to Eastern Cape Legislature, Meth highlighted trauma in Nelson Mandela Bay Metro, which he said stemmed from city's growing population and an unprecedented demand for mental health services. Meth stated that the bills will be paid by August 2022. That didn't happen, and in November, answering oral questions in the legislature, Meth said suppliers would be repaid. In his budget speech this month, Eastern Cape MEC Finance Minister Mtandeki Xamlashe said medical legal claims still continue to drain the state coffers, leaving department with serious cash flow problems. He said a strategy has been implemented to address this. The main goal of the multi-pronged strategy is drive provincial health services become more comprehensive and balanced in responding an individual patient, family and community health needs. Voko said there was a 96% reduction below a 3.4,202,223 of 104 million a 100,000,000,000,000,000,000,000,000,000,000,000,000,000,000,000,000,000,000,000,000,000,000,000,000,000,000,000 in 222 due to improvement systems and controls. The Provincial Ministry of Health has reprioritized its budget, provided Rs 544 million for medium-term maintenance and acquisition of much-needed health machinery equipment, he said. Cowley, DA spokesperson for Metro, said operating budgets of all hospitals in state had been drastically reduced in order for Eastern Cape Health Department to resolve successful medical legal claims against them. He added none of these steps had any impact on the backlog. The situation is so dire right now that the orthopedics department at Livingstone writes to patients advising they just do it. Cannot help them in any way. Also, doctors were not informed when the implants would be reusable, and they were not given any alternative hospitals to refer patients to. If all the above steps have been taken, how could the situation in Livingstone be so dire? Or why doesn't the department refer patients whose lives are in danger, even if it means referral to another agency? It is this callous neglect of patients that will continue to plague the medical legal allegations against the department. Moreover, it will deter more doctors and specialists from working in the public sector, and doctor shortages will continue to plague our hospitals. Steps to fix the problem. Department spokesperson Sizwe Kupelo said that trauma and violence-related injuries are increasing and their causes should be addressed as social problems. He said this will include opening additional theaters, hiring more staff, ensuring infrastructure is up to standards, and purchasing machinery equipment. He also added that the province has improved the anesthesia services in state hospitals. To reduce the need for Livingstone and other tertiary facilities, we have identified 10 peripheral hospitals across the province to focus on orthopedic operations. We have completed the renovation of 2 more operating theaters in Livingstone. We are in the process of recruiting additional staff for the 2 theaters, said DMMC.